Hello, everyone. So, today we're going to start with the factors contributing to healing and psychotherapy. So, psychotherapy helps us to go ahead, with the treatment of psychological distress. So, there are a lot of factors which are also contributing towards the healing process involved in all the psychotherapies. So to begin with, we have the first one, which talks about the techniques which are adopted by the therapist. So very clearly, when we talk about the techniques, whichever the therapist will be using as per the psychotherapy being used. And further, the techniques, we do have the implementation part as well, where all these techniques are also implemented, and so for instance, we have the behavioral system, the CBT. All of this is adopted to really heal an anxious person, an anxious client. Then we do have the relaxation procedures, we have the cognitive restructuring, where we are actually working on the restructuring of the thoughts, are also contributing towards the healing. So coming to the next, we do have the therapeutic alliance, where it is actually a special relationship which is being formed between the client and the therapist, and it does have the healing properties also. Now it makes it even more healing. Why? Because there is a regular availability of the therapist, and the kind of unconditional positive regard that he continues to maintain towards his client, the kind of warmth and the kind of empathetic attitude which he will continue to provide to his client. Then we do have the catharsis. So catharsis is the third point, where we are talking about the initial stages when the client is actually interviewed, and the therapist tries to understand the nature of the problems of the client, and he goes ahead with this process of catharsis, where the client will be really unburdening himself of all the emotional burden that he has been facing, and that process of emotional unburdening is actually called catharsis, and it does have the healing properties. So catharsis is a process where you get into this process of purification, cleansing, also clarification, and it is the process of basically releasing, and you tend to provide a lot of relief to yourself from all of those very strong and those very very repressed emotions. So it is in all basically the process of emotional unburdening, and that is what is meant by catharsis. Then we do have the last factor, which is talking about the non-specific factors. So these non-specific factors are nothing but they are actually the common factors, which are there in the psychotherapy. And these common factors are basically very common and quite non-specific in case of the patient or the client, and we do also see them in the therapist. So the non-specific factors in case of the client, or so to say the patient variables, can be like the clients or the patient's motivation for change, the expectation that he has of improvement due to the treatment that he's been taking up. So these are some of the most common factors, and that is why they are called non-specific, or also the common factors. Then in case of therapist, we do have like factors like positive nature, absence of unresolved conflicts, emotional conflicts. So there are no emotional conflicts, especially the ones that are not resolved. Then there is a presence of good mental health, and so all of these are so to say the therapist variables. Then going ahead with the, of course, the next one, where we're going to be talking about the ethics in psychotherapy. So the ethics in psychotherapy, it does have these six very important points, where it talks about informed consent, confidentiality, elevating of the personal distress, integrity, respect, professional competence and skills. So informed consent is all about that, the client must know what is actually going to be happening in the these therapeutic sessions, He should be aware what's going to happen, and he should be ready, with all of that, whatever is going to be happening in the sessions, like whether it's about sharing of the private information, whether that if they're going to make use of how, various techniques in the therapeutic sessions. So he should be ready with it. He should have actually given his consent. That means he's agreed to it. So that is basically called the informed consent where he's agreed to these techniques, he's agreed to sharing of the personal information. He knows very well that what is going to happen in these therapeutic sessions. So he's quite aware of it, and he's given his consent for it. So that is what is the meaning of informed consent. When we talk about confidentiality, it's all to do with the how the therapist can really keep the privacy of the information, and he is going to keep the information absolutely private in strict confidence, and he's not going to share it further. So this is what happens in the confidentiality. And it cannot be passed on to the other interested parties, so to say, because we do need to follow the norm of confidentiality. So elevating, of course, the personal distress is all about, like how the therapist can really reduce, can really bring about, that the feeling of ease to his own client, to his own patient, and can make him really, really better, little more feeling lighter, more joyful. So it is all about reduction of the distress, is all about bringing ease to his client. Integrity, of course, is a very important feature, where it talks about being absolutely honest, and to really have very, very strong moral principles. So it goes in for, of course, the entire practitioner client relationship. The integrity is very, very important, and needs to be maintained till the end. And then, of course, we have the respect, the mutual respect, for human rights and dignity. And professional competence and skills are very, very essential. So, of course, professional competence can talk about, the judicious use of communication, the knowledge, the technical skills about all the technicalities, the clinical reasoning, the value system, emotions, and all of that comes under the professional competence. And skills are very important for a therapist. And I'm sure that when he's skilled enough and quite professionally competent, then therapy is going to be a great, great success. So, this was all about the ethics in psychotherapy, and, of course, the factors contributing to healing in psychotherapy. Thank you so much.